you a breastfeeding mom who needs relief from cold symptoms? In this video, I'm going to talk about the safety of taking DayQuil while breastfeeding and how to get much-needed relief. 1. Guidelines for taking DayQuil while breastfeeding. When it comes to taking DayQuil while breastfeeding, there are a few important guidelines you need to follow. First, talk to your doctor before taking any medication while breastfeeding. Second, make sure that you take the lowest dose possible and only when necessary. Finally, try not to take DayQuil too close to when your baby is nursing, as this can cause more of the medication to get into your breast milk than usual. If you do decide to take DayQuil while breastfeeding, watch for any signs of adverse reactions in your baby, such as unusual sleepiness or fussiness. If at any point these side effects appear, contact your doctor right away. Remember these tips before taking DayQuil while breastfeeding. Talk with your doctor first, take the lowest dose possible, and watch for any side effects in your baby. 2. Types of DayQuil that are safe for nursing mothers. Though DayQuil is labeled as an over-the-counter medication, it still has active ingredients that may be unsafe for breastfeeding mothers. As such, moms should check with their doctors before taking any of the various forms of DayQuil. The two types of DayQuil that are considered safe for nursing mothers are 1. DayQuil liquid caps. This version of the product contains only acetaminophen, dextromethorphan, and phenylephrine, all ingredients generally considered safe while breastfeeding. 2. DayQuil severe cold and flu relief caplets. Containing a combination of ibuprofen and pseudoephedrine hydrochloride, this version is also considered safe for nursing mothers. However, ibuprofen can reduce a mother's milk supply and should be taken with caution. 3. Monitoring the effects of DayQuil on baby from mother's use. If you are breastfeeding and decide to take DayQuil, it's important to monitor the effects on your baby. If your baby is acting differently than usual or isn't eating as much, talk with your healthcare provider about whether taking DayQuil might be affecting them. Additionally, if possible, use a pump and dump technique. Pump breast milk ahead of time and discard it, but continue to feed formula or previously stored breast milk while using any medications like DayQuil. This may help lessen baby's exposure to the medication. Also consider keeping a log of how often you're nursing and when you give medication, so that if there is an impact on your baby, you can better pinpoint what caused it. 4. Side effects associated with taking DayQuil and lactation hormones. Taking DayQuil may cause some unwanted side effects. Some of these include dizziness, headache, nausea or vomiting, constipation, and dry mouth. In addition to the side effects associated with taking DayQuil, breastfeeding mothers must be aware that taking any form of medication while lactating can affect their body's production of hormones necessary for successful milk production. In some cases, this hormonal imbalance can also result in decreased milk supply. Therefore, it is important to speak with a healthcare professional to ensure there are no adverse reactions before taking any medication while breastfeeding. Doing so will help minimize the risk of complications and allow moms to still provide nourishment to their babies while keeping them safe and healthy. 5. Food and drug interactions with DayQuil and lactation hormones. It's important to note that DayQuil can interact with certain foods and drugs. The most common food interactions are with caffeine, alcohol, and grapefruit juice. Meanwhile, the most common drug interactions include warfarin, insulin, birth control pills, antidepressants, MAO inhibitors, and drugs used to treat HIV/AIDS. Additionally, breastfeeding moms should be aware of potential interactions between DayQuil and hormones related to lactation. These include oxytocin, a hormone responsible for milk letdown, and prolactin, the primary hormone involved in milk production. While there is limited information available on how these medications may affect lactating mothers specifically, it's best to talk with your doctor before taking DayQuil if you're breastfeeding. 6. Strategies to avoid potential drug residue in breast milk. If you are a breastfeeding mother, There are several strategies that can help reduce the amount of drug residue entering your breast milk. These include taking DayQuil at the lowest dose and least often as possible, waiting 4 to 6 hours after taking DayQuil before breastfeeding again, pumping and discarding breast milk for 2 hours after taking DayQuil, taking DayQuil right before bedtime, and abstaining from breastfeedings until morning, if possible, expressing enough milk to feed your baby during this time period, and refrigerating it for later use. These strategies can help minimize the risk of any potential drug residue getting into your breast milk without compromising your baby's nutrition. It is always best to consult with your doctor or pharmacist before taking any medication while breastfeeding. 7. Risks of not treating cold symptoms while nursing. If you are a breastfeeding mother and decide to not treat the cold symptoms, it can lead to serious risks. Not treating the cold could lead your baby to get sick as well, since viruses like the common cold can be passed through your breast milk. Additionally, untreated colds can worsen over time and may cause more severe illnesses in both you and your child. It's important to talk with your healthcare provider about how best to safely manage your symptoms while nursing. It's also important for breastfeeding mothers to take care of themselves during a cold. When caring for yourself during a cold, it's important that you stay hydrated and get plenty of rest so that you can keep up with your daily tasks and care for your child. Taking the right medications, like DayQuil, can also help you manage symptoms and stay healthy. In conclusion, breastfeeding moms can take DayQuil and other cold medications as long as they are aware of the potential side effects. It is important to talk to your doctor or pharmacist before taking any medication while nursing. Thank you for watching our video on this topic. If you have any questions or comments, please leave them in the comment section below. We'd love to hear from you. Don't forget to like and subscribe if you found this information helpful so that others can benefit too. Thanks again for tuning in.